I think while we give it one more minute and then I get started, I'm going to do a little bit of an introduction to myself so that you guys all know why I would be the one that would be talking to you today about families, and in particular families in regards to young adults. So again, my name is Trish, that I'm the current Director of Family Services at Recovery Centers of America. We have 6 facilities, 2 in Massachusetts, which is where I am live from today, 2 in the state of Maryland, 1 in Pennsylvania right outside of Philadelphia, and 1 in New Jersey, and a second one in New Jersey opening up this June. And in that role, what I'm able to do is exclusively work with the families and the programming to develop meaningful and sustainable programming for families of those that are working through their own recovery program. And so the experience prior to me coming to RCA has been predominantly working with young adults and families. So I am a family therapist in the state of Pennsylvania and licensed, specializing in co-occurring disorders, addiction, and trauma. And so the overwhelming majority of my career has been spent working with families, trying to educate them in understanding how substance use has impacted them, how substance use has impacted their loved one, and then creating strategies and interventions in a way that they can integrate this into the way that they want to move forward in the recovery process. So I've been in the field for about 25 years. And again, most of that time spending with adolescents and young adults. And so while this is going to focus in on the young adult population, we're going to discuss a little bit in the beginning in regards to adolescence and brain development, because the young adult is pretty much just a little bit older of an adolescent and their brains are still developing, which is what puts them at risk within substance use. All right, so I am going to get started. I will say, so bear with me as I try to get this. There we go. When we start to look at how to understand what becomes so unique, and that's a question that I get a lot from people, is so why is the adolescent, why is the young adult programming so specific, and why do we need to pay attention to how to treat them differently, and how do we treat the families differently than anybody else with a substance use disorder? And so it becomes important really to understand when we are doing this, the basis of brain development. And so in the beginning, I'm going to talk a little bit about the development of the brain so that we have a better understanding of what makes this population a little bit more unique. Why are we seeing such high rates of substance use? For those of you that are in the substance use field, you are able to recognize that right now we're seeing the highest volume of those that are receiving treatment are the young adult populations when we're looking at opioid use, heroin use, and certainly when we're experimenting with other narcotics, we're looking at the young adult population. And so then why is that the case? And so when we look at brain development, adolescence is one of the biggest growth opportunities for the brain. I always like to say the adolescent brain is in some ways very similar to those terrible twos that we think about with a young child. And so there's 2 times that the brain grows incredibly rapidly. And in that context of how fast it grows, it also starts to prune and strengthen certain neural circuitry. And so the adolescent brain, much like the toddler brain, is going to start utilizing their independence, they're going to start utilizing their coping skills, and they're sitting in what we would call the limbic system. And so we're going to talk a little bit about the prefrontal cortex in a second. And so this developmental period, when we're talking about the adolescent development of brain, extends all the way till the mid-20s. I think once upon a time, and I've been in this field for 25 years, early in my career, people were saying that the brain was pretty fully developed by the time that they were 18 or 19, and today we know better. Today we know that that brain is not developed until roughly 25 to 26, and that means that everything that is introduced to the brain becomes a part of the neural circuitry in its development and its growth. This is why the younger somebody begins to experiment with substance, the higher the risk for future substance use disorders. Because as they are integrating and introducing their brain to these chemicals, it increases the vulnerability for them to then fall into an addiction. And so the idea when you're looking at that, the adolescent has this pruning, is that the brain, because it's so rapidly growing, the brain needs to start to prune away some of the circuitry that is being utilized less. So if we think about the idea of why would that be necessary, is everyday experiences, your five senses, everything that's coming into contact within your brain is going to strengthen the part of the circuitry that you are utilizing a lot. And at the same time, things that you are not utilizing, the brain will actually start to prune away the circuitry of that to allow for more growth to happen in the parts of the brain that you are using more frequently. Now, when we talk about substance use, this also becomes an important piece to keep in mind when we're treating the young adults, because if they are using substances at a younger age and while their brain is still rapidly developing, what happens is that if an adolescent starts using substances because they are experiencing large amounts of anxiety, if an adolescent uses substances because they are feeling depressed, because they're feeling isolated, because they're feeling alone, because they are trying to calm themselves down, because they're angry, then what happens is that the prefrontal cortex, which would be responsible for helping to develop coping skills, that the coping skill neural circuitry, that starts to get pruned away. What gets strengthened is the parts of the brain that are going to reinforce the desire to use substances. We're going to talk a second about that, about the limbic system, is that that part of the brain gets stronger and stronger, while the cortex that is responsible for thinking through the consequences of your actions, weighing your choices, problem solving, that if that part of the brain is not being used because you use drugs instead of trying to think, weighing my pros and my cons, and should I do this or shouldn't I do this, that part of the brain starts to begin to get pruned away. And that neural circuitry is utilized less, while the neural circuitry that starts to crave and want to use substances gets stronger. So when we're looking at this view of healthy development of the child to adolescent brain, what becomes an important piece of this vision is, as you're looking at it, the blue is when things are starting to mature. And so in looking at whether it's the side view or the top view, what you're noticing is that the younger you are, the less mature your brain is, and that the regions that really what we're looking at in regards to helping somebody understand their substance use and helping them to understand and motivate their behaviors for change, the prefrontal cortex, you're noticing that as they continue to develop, that's the last part of the brain that develops. And so if we think about that, and this is why a lot of professionals sometimes will say, I don't know if I want to work with teenagers, I don't know if I want to work with young adults. They're more combative, they are, harder to get them to be rational, it's harder to get them to reason with their choices and to motivate them, and their delayed gratification is intensified, and so it's a struggle. Is that this is really, if we have an understanding of brain development, then we take it less personal, and we start to appreciate, that developmentally, they are not in the position that they are able to utilize the problem solving, the prefrontal cortex. And again, I can't emphasize enough, the prefrontal cortex is the part of the brain that in treatment, we are trying to activate. The prefrontal cortex is what we are trying to get them to weigh the consequences of their actions, to delay their gratification, to think through their choices. And that is the last part of the brain that is developed when somebody has used substances, younger than they were when they introduced substances. The more delayed that part of their brain gets as they get older. And so while somebody might be 24 in your treatment facility attempting to get recovery, what becomes important to understand is that while they're 24, and we hear this all the time, is that somebody will say they're the age that they started to use drugs, and I think we think of that as just a maturity. But the reality is that it really actually means that they're the age that they started, because it's where the introduction to the drugs started to impact their brain development. And so as we are engaging in treatment, and as we get to the part of the training that's going to really talk about, so how do we get families involved, how do we encourage them, and how do we help them to help their young adults, this is an important piece. I like to say that a lot of the families that I work with, the parents are going to start to be the frontal lobes of their child. but not telling them what to do, but really starting to help them to activate that. If we think of their brain as a muscle, if I'm telling you what to do in regards to the gym and I'm doing it for you, your body is not going to get stronger, right? So whatever you work out is going to get stronger. And so when we think about it in brain development, I need that young adult to start working out the frontal lobes. I need them to start working out the frontal cortex. And so I need the families to begin to help them weigh through the consequences of their choices, think through their actions, not during the crisis, which is typically what happens with substance use, but throughout their days, throughout their recovery. Because the more that the young adult can start to think through their own actions, and they need somebody to help them do that, that's them actually working out their brain and starting to develop the frontal cortex. So why that keeps happening. There we go. So the beauty is that sometimes people worry that so how does somebody end up recognizing if they started using at 14 years old, does that mean that things are never going to change? That when we look at the idea of brain plasticity and the critical period for learning and emotion regulation, this is similar to what we talked about a second ago in regards to the toddlers and then adolescents. That those critical periods for developing and learning emotion regulation are some of the most important time frames. And so what happens is that when people are saying they're so frustrated with working with these young adults, that they don't seem to be able to delay their gratification, they seem so irritable, they are so easily triggered, is that during one of the critical periods of their brain development and being able to slow down their emotional responses, the introduction of the drug became the coping skill. The brain reinforced that that worked. And so the actual coping skills during a critical period were not enhanced. So as a result of that, what happened is that these are now young adults that have difficulty controlling their emotional outbursts, that have difficulty weighing through the consequences of choices. And that's where that impulsivity, this is, the biggest struggle for a lot of people is the impulsivity in regards to young adults and working with young adults. And that's why impulsivity is a lack of ability to emotionally regulate yourself. Brain plasticity is the hope. That's what I always say. Brain plasticity is the hope that the more that we engage in some of these behaviors, as I had said, those families and ourselves being part of the frontal lobes and the prefrontal cortex for our adolescents and young adults, brain plasticity is that the more that you start activating some of that neural circuitry, it will start to pick it up. And so there's hope in teaching them these skills, but what happens, this is what we'll talk about when we get to the families, is the families become so oriented around the crisis because of the fear of losing their child, because of the fear of the addiction, that what ends up happening is that the families aren't strengthening the prefrontal cortex, but they're reinforcing what would be considered the limbic system. And so if we understand the brain, you have the prefrontal cortex, which is responsible for problem solving, as I've mentioned, the limbic system, which is the part of the brain that is where the emotion center is driven. The limbic system is where impulsivity sits. It's where the amygdala is, that is your fight or flight. It's where the hippocampus is located, which helps to retrieve memories and reinforce behaviors. And when we're talking about substance, it's also where the nucleus accumbens is located, which is what releases dopamine as a reward for pleasurable experiences. And so looking at this vulnerability as an opportunity, the mere fact of adolescence is that vulnerability, the high risk taking that is inherent in young adults and adolescents puts them at a higher vulnerability for substance. The super unfortunate way of development is that adolescents, because they are predominantly sitting in their limbic system, and that reward system that is being constantly kind of triggered by the thrills that they seek, by the drugs that they might be taking, by the impulsivity that is rewarding to their brain, the highest risk population to experimenting with drugs is also or also has the highest vulnerability to developing a substance use disorder. I apologize that every time I do this, the screen doesn't click. So then when we start to look at, so how do we understand today? So I wanted to go into a little bit of substance use before we really get onto family, and the remainder of this training, once we talk a little bit about substance use and the crisis that we're looking at today, is going to be in regards to, so how do we help the families and empower them in regards to helping their young adult? And so when we look at today's substance use crises, we're looking at the top 3 substances of young adults. And when you look at the adolescents and the young adults, the blue and the orange bar, for prescription drugs, we are looking at the highest population is the young adult population. So that 18 to 25 is the highest risk for today's substance users on prescription drugs. Marijuana and alcohol continue to be high, but adolescents are now higher for marijuana. I think, again, if we were looking at the legalization and some of the conversations and the decriminalization, which is a whole different topic, we're seeing more kids today using marijuana than we are alcohol. And so this is the natural progression. And again, keep in mind that if the substance is introduced to the brain, the younger it is introduced, so however somebody feels in regards to marijuana use, if we're talking about an adolescent brain, the younger somebody is introduced to substances, the higher the vulnerability and the higher the risks in developing a future substance disorder. And so that number, when we're looking at marijuana, between 12 and 17, this is one of the highest risks of young adults, then going over into opioids, cocaine, and heroin. So in context, again, understanding where are we looking at in regards to today's adolescent and young adult population. Use of prescriptions is highest for that age, 18 to 25. We are seeing higher rates of overdoses in this population in regards to the opiate use and or combined with prescription drugs and heroin, certainly if it's laced. And so we're looking at a consistent trajectory of increased substance use from marijuana in adolescence to prescription pills and heroin as they go into young adults. And so the national overdose death, again, this becomes an important piece. We all know, we're all watching the news, we're all working in the field, we know what we're at risk for. And so this only goes to 2015. I know in 2017 that we saw over 70,000 lives lost to substance. And so every treatment facility, I know at Recovery Centers of America, our mission is to save 1 million lives, including the lives of the families that are being most impacted by this incredibly tragic epidemic. But 2017, we've lost over 70,000 individuals to an overdose. And so how do we then treat the families? This becomes even more of a plight for all of us, because when it comes to a young adult, these are families that were not even done raising their children. And so the fear that if this is what they are facing, the behaviors of the families have also escalated and elevated. And I say this all the time. The families and the patients have parallel processes in their recovery. The families are faced with an overwhelming sense of grief and loss on a daily basis. You have a young adult child that you are not done raising. Every part of you is going to fight to keep that child alive. That's instinctual in who we are. If your child is suffering with a substance use disorder, every ounce of you is going to try and save them. And that then inherently becomes a part of a traumatic response from the families. And so sometimes what I get the most feedback from in regards to when I'm talking to different clinicians, whether here or nationally, when I'm talking to clinicians about that, the clinicians are overwhelmed by the families. They're always calling, they seem to be always kind of coming after me, and they're angry, and they're this, and they're controlling, and they're overbearing, and they're helicoptering. And I go, right, because they're scared. Because every day they have to face that this might be the last day of their child's life. And that is there's nothing more profound than that in regards to trying to figure out how to parent. And so the rest of this training is going to be, so how do we understand what's going on with the families? And then how do we help them help them? And so today, young adults are the most impacted. That we know. So then how does this end up changing into treatment for families? And I say this a lot. I've been in this field for over 25 years. 10 years ago, when somebody was using and they were to say to me, Trish, there's a chance that I'm going to use over the course of the weekend. We would do what we needed to do. We would talk about harm reduction. I would include strategies that would allow for them to stay safe. Today, if somebody were to say that to me, I would be worried that this will be the last time that they would be alive. Now, imagine being a family member and knowing that your child has a substance use disorder that could likely kill them. Then broadening it, if this was any other chronic illness, people would be supportive of the families, they would offer to help them, they would ask what it was that they needed, they would provide them with meals and kindness and love. But with the stigma of substance use, what happens for these families is they begin to get isolated. That the shame that other people have misunderstood what has happened, how did we get here? And this chronic fear of losing your child completely changes the way that the families are now interacting in treatment. And so the necessity of getting them involved becomes even more important. And so when I talk about addiction as a disease of isolation, the reality is that people heal through connection. Substance use can heal through connection. Families can begin to heal through connection because the profoundness of what this disease does is it continues to isolate. And so recognizing that we're not in a vacuum, that when we meet with a patient by themselves, and I will say this is one of the biggest struggles for most people when they're working with young adults, is that they will say, I asked the young adult if they wanted me to reach out to their family, and they said no. And I go, okay, and then what? And normally they're like, well, I didn't call the family. And I'm like, but that's a clinical issue. That this is a young adult. You've got a 20-year-old kid who is struggling with substance use, that's coming to you for a substance use disorder, whose prefrontal cortex we know has not fully developed. And we're short-term. Whether you're inpatient or outpatient, you are short-term in the life of a human being. And so clinically, that's a conversation to have with a young adult. Could they be worried about their family getting involved? Sure. Sometimes they'll say, my family's not healthy support because they're using as well. And I go, okay, so then that's something that's important for me to know. If they're worried about, which is a lot of the young adults, I've already put my family through enough. I don't want you to bring them in here because I know that they're tired. I know that they're already stressed. That is also a clinical issue that I say, so this is why I want them involved, because they need help too, because they need support, because nobody's told them how to raise a child with a substance use disorder. Nobody's told them how to help you work through your recovery. People have told them to stop enabling. People have told them to stop being codependent. People have told them to stop being a helicopter parent, but nobody's told them what to do to help. Because if we don't give them that, families are going to continue to surround the crisis because the love that they have for their child is that profound. I'm going to check in on the questions as we kind of move through this. So one of the questions was, what is your opinion of guilt and shame as prefrontal emotion regulators in addiction recovery? So guilt and shame is going to sit in the limbic system. So if we are really looking at how that's an emotional expression, guilt and shame are part of, in all honesty, guilt and shame come out. So guilt is that I feel bad about a behavior that I've engaged in, and shame is that I'm not a good enough human being, right? So it's like a version of each other. And so looking at how to address that, those are huge things. And so that's a great question, because those are also two of the biggest barriers for somebody to try and find recovery. Guilt and shame are part of the secrets, right? If I feel guilt or shame in regards to my substance use, I normally am going to protect it because I don't want to talk about it. I don't want to say all the things that I've done, that I've stolen from families. I've done things out on the streets that I don't want to admit to. And so that's more of a limbic system. And so I want them to calm their system down. And so some of that I talk a lot about when I do the discussions on trauma, but it can go across the board in any context, is that I want to calm their system, because if I can get them to the prefrontal cortex is where you feel shame and guilt, right? That I feel bad about something that I did, and then I drop down into my limbic system, which is where I am going to judge myself, which is where I'm going to engage in these disruptive behaviors, trying to alleviate that feeling. And so the focus in regards to guilt and shame, to me, is to focus in on the limbic system and calm it down enough so that they can understand the behaviors that they engaged in relation to the substance. The other question is that I mentioned fear in family members. Would you consider helplessness as a modulator of family members' responses or to the identified patient? Yes. So helplessness is when you're talking about families that are watching somebody that has a chronic illness. Again, if this was not addiction, the helplessness that they felt, they would begin to grieve. That they would recognize that if you had cancer, if you had another illness, the grief process would almost be immediate. What happens with addiction is the helplessness has been shrouded by their own guilt and shame. That even if families can rationally understand that they are not the reason for this substance, this is not their fault, that the shame and the guilt in regards to how to understand this is then complicated with the helplessness. And I say this to families all the time. The reality is that they cannot save their child from the substance. That's not what happens. What they can do is start to structure their, I always use the ship analogy, right? If their child is on a ship that has holes on it, and the family is on another ship, every ounce of that family wants to lean over into that ship that has holes in it to pull their child out, to drag them over to the safety of their ship. But when you are leaning that far in, and that's the helpless feeling, you want to save them, you want so tightly to control them, to prevent them from death. That is that behavior that people want to judge, is that they want to squeeze them so tight that they can keep them safe. The role of engaging families is not to help them think that they're going to save their loved one, but to help them to understand that if you create your ship to be incredibly sturdy and safe, that when your child starts to work through their recovery and they extend their hand to you, you have a safe place to pull them. Because if you're leaning over your ship into theirs, they will sooner pull you into theirs than you will be able to pull them into theirs. And so that's that shift. And so helplessness is, to me, a driving force for a lot of these families that are doing everything they can that they think is going to allow them to save their child. So I know that there's a few more questions. I will get to them. I'm going to go through a few more of these things. Some of these things I'm not going to go into quite as much detail so that we have time for questions towards the end, and that you'll have access to this and you can certainly read through it. But when it's looking at, so how do we, and this is where we're going to move forward. So how do we as providers start to engage the family in a way that becomes sustainable and meaningful and really helps within the lending of the recovery process? That the National Institute on Drug Abuse is recognizing that treatment for somebody under the age of 25 should look different than somebody over the age of 25. And some treatment facilities are going to use the young adult as 28 and under. I'm not going to kind of split hairs in regards to what officially becomes a young adult. because for all the reasons that I just said. You might have a 28-year-old that's still living at home that has been using substances since he was 13 or 14, and so they might still benefit from the same type of approaches. But what we do know for certain, based on research that we have seen, is that addiction treatment should be approached differently for those that are under the age of 25. And then when we look at the uniqueness of the family system, because so many of the young adults are still living at home, and this is where every family should be involved, and that's sometimes controversial too, that somebody will say, well, so what if they aren't healthy? And I'll say, is that young adult going home to that family that they're saying is not healthy? And when they say yes, they are, then I say, then I want that family in. Because I'm going to bank on the fact that the family's not unhealthy because they're choosing not to be the right person for their loved one, that they're engaging in behaviors that might not be supportive of recovery, because they might have their own substance use disorder themselves, because we do know that this ends up becoming a multi-generational disease. And so then they still need support. That I want that family in just as much as I want the family in that says I'm figuring out everything that I can possibly do to help support them. Because I want to be able to change the system, because I want them to know that they too have somebody in their corner, and that if you're struggling with your own substance use, allowing them to be in treatment without the shame or the guilt of their own issues might open up the door for them to have treatment as well. So when we look at, family programming for young adults, working with young adults, so what should this look like? It should be that there's weekly contact with that family. And again, sometimes the biggest issue for young adults, they don't want you, they're not going to sign a release of information. And I normally will say this. I've been doing this for 25 years. When you ask a young adult to sign a release of information, has a lot to do on whether or not they will do it. So sometimes we do the assessments, and we do an assessment and we ask them about their drug use, and we ask them about their abuse history and all of these very stressful questions. And then at that moment, when they're already incredibly triggered, we say, can you sign a release for your mom or your dad or your family? And they're already triggered. So we have disabled their prefrontal cortex. So they're not thinking rationally anyway, because we've triggered them. And so the timing of asking for a release of information becomes incredibly important, and the way we are asking. I have said this, I have never asked somebody if they would like to sign a release of information for their family member. The same way that I don't ask anybody, do you want to participate in our treatment groups? Do you want to participate in your process group? I don't ask those questions because it's an expectation, because it's clinically relevant. Because I know that it's important for their well-being, and because I know that it's necessary for their recovery. And so for the same reasons, I don't ask, do you want to sign a release for your family member? Because I know the answer is going to be no. What I normally will say to them is, hey, who are we gonna have a release signed for? So you tell me who's gonna have your back when we release you. Who's got your back outside of these four walls? Because I wanna make sure that I reach out to them and let them know that we're here, let them know that you're safe, and to offer our support and our resources to them. In 25 years, I've never had a young adult that has refused it. In the beginning, they would, if I asked them in the wrong time, but I always resurfaced. And when they didn't sign it, I said in those moments, listen, we're gonna have to come back to this, because I'm gonna need a release from somebody, because I need somebody to help you outside of here, because people don't recover alone. And we won't be with you after 30 days. And so I need somebody that's gonna have your back outside of here. And then I revisit it after they've gotten to know me a little bit better, where I can help them to express what they're worried about in regards to that release, and reassure them that this is to be a support to both them and their family. And so weekly contact for the family is necessary. Psychoeducational seminars, today's families have no idea what's going on with these substances. Even families that have had multi-generational use of substances, is that if you've had a 2-generation family that maybe had alcoholism in the house, and now their son or daughter are using heroin, they have no idea what to expect. And so psychoeducation is incredibly necessary. Understanding the disease model of addiction, helping them to understand what are boundaries, because these are families that have been told time and time again to either kick them out, to not kick them out, to give them money, to not give them money, that you're enabling their behaviors because becoming codependent, and these are families that need guidance on how to set boundaries within their own lives. I'm not telling families what to do. I'm helping them to explore what are the boundaries that are important to you. What do you need to do in order to support yourself? And again, I'm going to say the same thing I said earlier. Recovery is a parallel process. And just as sometimes these young adults end up having a recurrence of their disease, so do the families. And so they might be actively working towards setting appropriate goals and boundaries for themselves. Then they might slip back and allow for their young adult to engage in a behavior that they said they weren't going to. That doesn't mean that they've stopped caring. It doesn't mean that they are enabling them. It means that in the moment, they have also had a recurrence of this disease, and they need the continued support to change their behaviors. Multifamily DBT is a fantastic program that if somebody's able to do that or somebody's able to engage it, it's so that the family members and the young adults learn the same skills so that they can speak a common language. That's not a necessary part of it, but it's a great program. So this is what substance use treatment should look like if you are working with young adults. So early intervention, if your organization can get out there, so I know at RCA, you know, I'm super privileged that I'm able to do things like this, and that RCA encourages me to work with local high schools and local universities and go to speaking at community events. And we have other people that are experts in the field that do the same thing, because the more that we can get this information out there and support families before it happens, and support adolescents, that we are able to kind of fight it. But even if we are doing this and there's people that are active, that they continue to have additional resources. So you want to be able to have that within your own facility. That you want to have customized, personalized treatment plans that are specific to the needs of a young adult. So recognizing ADHD and its prevalence, that should also be screened through appropriately. I kind of always kid, everybody looks a little ADHD when they're coming off of substance use. And so the diagnosis should not be as a result of the way that they're behaving after they have been withdrawing. It should be something that they are likely to have seen prior to the substance use starting. If they started at 13, I need to know from mom and dad, or whoever's raising that individual, were these symptoms present prior to their substance? Substance can change the way that they experience some of these other co-occurring disorders. It should include behavioral therapy and CBT, that these are really effective. So what young adults are not huge fans of would be something like this, a webinar, right? So young adults do not necessarily want to do lectures. They don't necessarily want to engage in these long process. And so if you work with young adults and you happen to also work with adults, you actually can tell the difference in a process group, because the young adults are a lot more concrete. That's not because they're trying to be stubborn or resistant. It's developmentally appropriate within the context of their brain. And so behavioral therapy is effective for them in those moments because it is more concrete, particularly if you have somebody with ADHD or any of the other co-occurring disorders. Contingency management is a great way, again, of particularly in an outpatient, that because the delayed gratification is still a struggle for these young adults and we're trying to engage them in meaningful ways of sustaining some recovery, contingency management is a great way to incentivize them to attend group, to participate in group, and to continue to work towards sobriety. That people tend to do better when they actually can start moving towards something as opposed to running away from something. Staff being trained and educated on the young adults. I always think it's funny when people will say to me, Trish, I'm never going to work with adolescents, and then they're working with a 22-year-old. Like, the same thing. So being educated, making sure that your staff understand the difference between the developmental periods and the critical periods of the adolescent and young adult brain, because it will look and feel very different. And what you don't want is staff that are reacting to a young adult's appropriately developmental behaviors, because we're trying to teach them those skills. Keep in mind, the way that the brain works is if their coping skills to allow themselves to get regulated were pruned away because they used the drug every time they got really angry and that calmed them down, then somebody's going to need to understand that, because you're really starting to teach them all over again, right? You are their frontal cortex, so you are teaching them skills, but you've got to learn how to be able to be present in the midst of their impulsive behaviors. And then 12-step facilitation and therapy is always a fantastic thing. Again, getting them outside of themselves, tapping into that prefrontal cortex. And so special considerations for families of young adults. Here are some of the important pieces of keeping in mind. That families actually develop patterns of behaviors that become integrated into the family structure. So what does that mean? It means that you might have a family member that starts checking their young adults' cell phones, that they don't go to bed at night until somebody comes home, that they are chronically changing the way that they go to work because they want to make sure that they're accessible. So they're engaging in these behaviors. But if we keep in mind how these behaviors started, typically a substance use disorder is identified months, if not years, after the substance use began. And so if we understand that families are organized for homeostasis, so keeping things okay and normal, but families are also organized for survival. They want to make sure that their child is alive. And so however long before they realized they had a substance use disorder, those families had started to reorganize behaviors around it. So mom or dad not going to bed at night, giving money, whatever the behaviors are, these started to become a part of the family structure. And so when in crisis, when they are worried the most, they're going to go back to the behaviors that they think have helped to keep their child alive. So helping the family to see what behaviors are they doing and what is the purpose, that's helping them to set appropriate boundaries. Not just telling them, you can't check the cell phone, you can't do this anymore, you shouldn't drive by, because that won't make sense in a crisis. Because if that's what they did in a crisis, they are more likely to continue to do it in those moments. So helping them to understand what can they have control over and what can they start to let go of that won't change the outcome of their child. And so that's that families organized around the substance use. And because the family roles have been compromised, the family takes on additional behaviors to protect the child, right? So that whole idea of enabling and codependency that people continue to use, again, everybody has their own language. To me, enabling and codependency is more of a judgment, or it can feel that way to a family. I know I'm not supposed to do these behaviors, but I don't know what else to do. And so when they start to understand this is why you do it, that your brain has organized. And an interesting thing, which I didn't put in this PowerPoint, is that they've done research on the brain of family members who have a loved one with a chronic illness. And that was including substance use or any other chronic illness. And much like somebody with a substance use disorder, where the neural circuitry started to change and the neural connectivity changed to orient around the substance use, for families of somebody with a chronic illness, their brain has reinforced the behaviors that they think have helped them keep their child alive. And so these enabling and codependent behaviors are actually neural circuitry that is being reinforced and has gotten strengthened in their brain. And so there's no judgment in that. Of course you do these behaviors because that's what you have been doing for however long the substance use has been in your life. And so that's not enabling the behaviors, it's engaging in behaviors that are just preventing recovery. But the reason why it started was because you were trying to fight for your child's life. And so helping them is renegotiating the relationships. Families weren't done raising their child. So when you have a family member of a young adult, they weren't done. They were still raising them when this took over and when their family got hijacked. And so helping them to reestablish how to help your child launch, how to help your child start to gain independence, all of those things that when you think of the critical milestones that somebody at 18 to 22 is supposed to, right? College, getting into the workforce, going into a trade. These are all huge milestones that families have to organize around to help launch that young adult. But the young adult also has to start to strengthen the ability and the courage and the confidence to be able to succeed at that. And that was all disrupted. So helping the family, but now we're switching it. So now I want the family to help them launch into this next huge, courageous step. I need that young adult to feel confident in their ability to take this next step into their recovery, to get involved in 12 steps, to get involved into a recovery program. But I need the family to do it in a way that looks similar to how you would encourage your child to get a job, go to college, get an apartment, anything that's that launching period. And so when we look at how some of these family patterns have been impacted, the roles have changed. There's sometimes a reversal of the way that you are engaging. So now all of a sudden, and you'll find this with the frustration for the young adults, is that they're going to say, my parents are treating me like I'm a small child. That the reversal is that the family all of a sudden, because of the fear, is now parenting them as if they are 10 years old all over again, right? They're going back to a time where they actually could instinctually protect them. And so having that as a conversation, that I do need them to start letting go of that, because I need that young adult to begin to develop their own confidence to be able to successfully launch themselves into recovery. This isn't just about a job or college. I need them to begin to feel confident in their recovery, and I need the family to support it as opposed to dictate it. The control and power struggles that we're going to continue to see with a young adult, those are appropriate. If any of you have children that are young adult age, or you were all young adult at one point, you remember the control struggles that you had during that age, that launching period. And so some of this is appropriate. And so helping the families to tease out, this is normal developmental behaviors, this is appropriate. And so we need them to find their wins, and we need you to find your boundaries so that you can support them. Some of these I'm not going to go over because I kind of continue to go over them, and I want to make sure that I'm being respectful to everybody's time. And so we talked a little bit about the role of trauma, and I mentioned how the brain organizes around the addiction. Is if we understand that a family has been impacted by trauma, that today's disease and today's epidemic is inherently leaving families feeling traumatic. I just read an article today on my way to Massachusetts that talked about PTSD, in that we once understood PTSD to be an event, and that what they're recognizing is that there's PTSD for people that have sustained nervous system arousal. And so what has happened is these are examples of the patient who is struggling with a substance use, which is chronic in nature, but also in regards to the family who on a day-to-day basis is worried about the life and death of their child. And so when they call you 15 times looking for answers, when they are angry because they don't feel like you have done enough, when they are frustrated because they feel like they were supposed to have heard from you and they didn't, when they're telling you that they're trying to dictate the treatment of their young adult, if you can see that through a trauma lens and appreciate the struggles that that family is showing you that they are continuing to have, then we can respond differently. That when a family calls me, that I'm going to validate that this is incredibly difficult, and that I'm going to listen to what their concerns are. It's not personal. This is how they have learned to try and get by, because every day they are being triggered by life and death. And so if we change that view, then I'm not frustrated if a family calls me 10 times. I'm going to make sure that I'm consistent with them, that when I call them back, I'm going to tell them when they should hear from me, that PTSD sits in the nervous system. And so the only way, anxiety doesn't go away by being ignored. So the only way I'm really going to be able to help that family is to hear what their concerns are and to help address them. And so when we look at how families should be involved, again, we talked a little bit about that. So offering family sessions or weekly engagement, ways that they can stay involved, ways that you're able to support them, offer them that educational pieces. And so here's a big piece. And this will probably be where I end and open it up to the questions, and I'll go into all those questions. So family sessions, and again, however those look, if it's family therapy, if you're doing family sessions, if you're doing family consultation, again, whatever your parameters are, is that this can be done by most people that are involved. These have to be strength-based. so that we are recognizing, again, a young adult who has not finished developing their own sense of self, and we need them to start to develop their own confidence and their ability to be able to manage their addiction. We're going to have to look at the dynamics that are going on with the family and the developmental tasks, so that launching period of helping them to be able to get their loved one to safely begin to launch, and figuring out how the family can do this. Support and education on boundaries. Boundaries should be in those sessions. So in an educational piece, you can talk a lot about boundaries, that boundaries are about yourself and not your loved one. Family members oftentimes get that confused. So they will think that the boundaries are set for their loved one. And so helping families to understand boundaries are about you. What do you need to stay safe inside your own home? How do you need to be able to live through each day? That's your boundary. Him not going out with his friends is not your boundary. That's his. And so how do you set, I can't have this happen? But then in sessions or in phone calls, being specific to the needs of that individualized family. Sometimes for young adults, you might need to have a meeting with the young adult separate from the family, because it's a little bit more hostile, and that there's a different focus. So for the young adult, you're trying to get them to help launch, and for the families, you're trying to get them to help them launch. So you have different groups and focuses, and then you can bring everybody together to prepare them for how to do this moving through together. I am going through this a little bit quicker right now so that I can get to it. So family session don't. Traditional family therapy. So this is a big thing that a lot of people, this is probably the #1 reason families will say that the family sessions were not helpful. In early treatment, family sessions should not focus in on everything that that young adult has done wrong, on all of the things that they have done that have been terrible, that you stole from us, you did all these things. In early recovery, that is not the time. So if you are familiar with the 12 steps, right? Amends is step 9. I always share that with families. That's not to say that they're not going to get to the place where they owe you an apology, that they recognize and appreciate what has happened as a result of their substance use. But in early recovery, it's not today. And so those sessions should not turn into fights where the young adult is accusing the family members of all these things that they've done, and the family is accusing the young adults. That is not healthy, and it is not supportive. They don't have the skills yet to be able to keep themselves from becoming overwhelmed. And I always like to say, this is a disease that is relatively unpredictable. We can't guarantee recovery for everybody. It's what we are actively fighting for every day. But God forbid a family and their young adult get into an argument and say things that are harmful or hurtful. That young adult leaves against advice and uses an overdose. The last words that that family would have had would have been those accusations, the mean-spiritedness. It's too soon in recovery. And so that we need to make sure that that is not a part of those family sessions. And so how to help them, this will be the last slide, and then I'm going to go into the questions. Provide education. I can't emphasize that enough. Education, 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 education. Families need it. They don't understand this. They don't understand the disease model. They don't understand the immediacy of heroin or cocaine or what's going on in today's culture. How to have connectivity in the relationship, so how to be angry at the disease and still love your child. How to set a boundary but still support. Those are conversations families need. That sentence alone is something families need. You can hate this disease and still love your child. You can set boundaries and still have your child connected to you. That is a huge piece for families. Oftentimes they think it's one or the other. So I'm going to go into the questions. And so what are my views when a family wants their child to get help, but they want God to be the main focus versus the child's addiction? So this would be another one of those questions. That's a great question. So I'm still going to focus in on education. And so they want spirituality, if it's that important to them, then I'm going to validate the experience of it. I'm going to ask how they utilize religion in regards to their own recovery process. If they're saying that they think that God is going to heal them versus going into treatment, and we've got somebody that could die at the hands of this disease, then I'm going to work with the family and trying to provide them additional education. But the validation is, again, continuing to offering it as resources, what are their opportunities, and how to do both. So this doesn't have to be an and or, this can be an and together. So we can utilize your spirituality, we can utilize your religion, and we want to make sure that we're being respectful to this disease so that we can fight this together. Okay. What are your views when a family wants their child, oh, sorry about that. As a trauma-trained therapist, how do you aid the families in dealing with trauma of loving an addict and moving away from the central nervous system response to the loved one in treatment, early recovery? Well, that is a loaded question. So, as a trauma-trained therapist, I'm a big fan of helping the families gain the same emotion regulation skills as the patient. And so that's another reason why I'm not a fan of having the patients and the families have conversations too soon, because the families nor the patient have the ability to calm their nervous system. And so I also am pretty transparent. And so I like letting the families know, listen, this is where you guys are sitting because it would make sense. This is an emotional disease. You are afraid most of the days of your life. And so you're chronically being triggered. Your child comes home 5 minutes late when they don't text you when they said they were going to. And so what I want from you to do is to start calming that nervous system. Sometimes we talk about self-care in a way that seems obscure. And here I talk about self-care as this is physiological. When you do something for yourself, it helps you to calm the nervous system, because if your nervous system is too triggered, you cannot be rational. And so you already know how to be rational. I just need you to take care of that system. I need you to recognize and appreciate when you are triggered, how to calm it first before acting. These are the same things that we're teaching your loved one. Hopefully I'm answering your questions. If I'm not, you can shoot another one. How can I get a copy of this video? This video will be posted, I believe, on YouTube, but the C4 conference, they'd be able to let you know in regards to that. And again, you will have access to the PowerPoint itself. What is your response to those that say that addiction isn't a disease, but a choice? That is a whole training in and of itself. The short answer, which seems a little bit more tongue-in-cheek, is that I always say, this is the only disease that everybody thinks they're an expert, right? You go to the convenience store, you go to a gas station, everybody's got advice on what you need to do about this disease. And so that's where I go. If somebody has that, and families still struggle with that, I'll say, this is why you need the education, is let me help give you the information and the facts, because what we've done is we have so much information today on the brain. We have so much information and research today that we didn't have 20 years ago. And while I can appreciate the understanding and the confusion of it, let me help give you some information so that you can make sense of it with at least today's facts. Only disease that people listen to opinions rather than the experts. So that's normally how I would say it. There's still a lot of families. If it's inside your own organization, I would make sure you're training it. You don't want your own therapist. Let me see if I got everybody. What do you think of the CRAFT model of family intervention? I love it. CRAFT model is terrific. It's a terrific model for, so it's community reinforcement and family therapy. And so it uses actually a little bit of the contingency management that I was talking about. It's great for an outpatient level of care for families that are motivated and for young adults that are motivated. Harder to kind of figure out how to strategize to get into an inpatient, but I think it's a terrific model if that's something that you're doing. It has a lot of evidence-based research behind it, so it's a terrific program. I think I got to everybody, but I'm going to double check. I did. So I have answered all of your questions. I appreciate all of your time. Thank you for checking in. Thank you for your time. If everybody would just stay on for another minute, there will be a poll that you can take in regards to your experience doing the webinar. And then you will be able to post all this and access any other information that you need. So I appreciate it. Thank you so much. Have a wonderful day. If you're on the East Coast, enjoy the sunshine.